Hi everyone, Dr. Garner here to help you guys out with a very common question that I get. Now, this question comes from people who may struggle with hip issues. Maybe you've had a hip scope, maybe you haven't. Maybe you just have hip pain. Maybe you just have back pain here. But the point is, it's really hard to know when you're doing yoga, when to use the whole block between the knees thing during chair pose. And this is what I'm talking about. The classic, let's put a block, right, between the knees and do our chair pose, whether chair is here or whether chair is here. I'll address that in a future video. But for now, when to use or not use the block. If you have issues with the hip flexor, that means you may feel like you're constantly stuck in a seated position because maybe you spend all day at your desk, right? So if you're constantly stuck in that folded position and you stand up and you get ready to take a step and you have pain here or tightness, right? The other way to tell is if you can't get your knee up to your bum without it arching your back or without splaying the knee out to the side. If you can't do those two things, then chances are, your hip flexors are too tight because you should be able to, at least in a neutral spine, bend the heel up and have the knee, balance. Have the knee not be forward or out to the side, just straight up and down in line with your trunk. So that's another way to tell you might have a problem with the hip flexors. If that's the case, or when you bring your knee into your chest, you have pinching or tightness in the inner thigh muscles called the adductors, then, that was a bit of flash of lightning from weather, then don't use the block. Your block is not your best friend for chair pose in this position. Ditch the block. Instead, you may be looking at using something like a yoga belt. Let me grab that. A yoga belt I really prefer in the medical therapeutic yoga method that I developed and teach. I prefer using the quick release buckles, not the ring buckles. So when you do that, you will do chair pose this way. Okay, it's up to you whether your toes face forward, out to the side, or even turn in a little bit. I have methods for determining which one you should use, but right now go with comfort level. When you start to do that squat, again, there's different reasons to do this squat versus this squat. I'll share that for a different video, but it's right above the knee, and then you want to press the legs out as you come down into the squat and press the legs out as you come up, okay? And then after, get a full breath so that you feel everything stretch on an inhale, pelvic floor, diaphragm, exhale. Right, back up. If you haven't watched my breathing videos, I would recommend that you watch the AD breath video first in order to really train your breath properly to do this particular pose. But this is the way I would have you do the pose. If you're having snarky psoas or hip flexor issues, you definitely want to ditch the block, right, and go for the strap instead. I hope this has been helpful, and if you have questions about it or are wondering, gosh, what else should I change about my practice because I have a snarky psoas or pain in the hip or back pain, then reach out in the comments and let me know. And if you haven't subscribed, consider subscribing to my YouTube channel where we put out new videos regularly. All right, guys, hope this helps you.